And away from that story, as Nigerians join the rest of the world to celebrate Malaria Day, the Pharmaceutical Society of Nigeria has called for more funding and investment in the healthcare sector to close the global funding gap in tackling the scourge of malaria in Nigeria. The president of Pharmaceutical Society of Nigeria, Abuja branch, Ifeanyi Eke Budu, preferred ways to prevent malaria spread in the country. Benedict Uku has more on the story.
Nigeria has the highest burden of malaria in Africa, with an estimated number 61 million cases and 207,000 deaths annually. On this World Malaria Day, the call to action were made to invest, innovate and implement to deliver zero malaria in Africa and Nigeria. The Pharmaceutical Society of Nigeria, Abuja branch, has seized the opportunity to call on Nigerian government to close the funding gap to tackle scourge of malaria. In a press conference and sensitization program today in Abuja, the president of the Pharmaceutical Society of Nigeria, Pharmacist Ifeanyi Eke Budu, also drew attention to the best measures to prevent malaria spread.
We are not investing properly. You see, there's a huge funding gap between what is needed to tackle malaria and what we have presently. The report said that 97% of malaria at risk of having, 97% of Nigeria have risk of having malaria, but it is more prevalent in the lower income persons. So malaria is seen as a disease of the poor. Probably that is why people are not investing very well in malaria. Probably, I'm not very sure. I don't have that fact. But if you look at it critically, those in the high echelon of society rarely fall in to malaria. The incidences are lower than those who are in lower income area. Then secondly, what we're not doing well again is that even when we invest, the second thing is that we're not innovating appropriately. We're not getting new products, because what we keep on doing is recycling what we have been using all the time.
The vice chairman of the society, pharmacist Abubakar Dangara, said that the concerted effort needs to be made to increase investment in tackling malaria. He called on non-governmental organizations to complement the efforts of the government in investing in healthcare.
The most important thing to look out in prevention of malaria is to understand how malaria comes about. Malaria is as a result of the bite of a mosquito, the female Anopheles mosquito. If you are able to control the mosquito, you won't have malaria. So the zero tolerance we are targeting, how to achieve it, is vector control, environmental hygiene, clothing in the evening, long clothings, and screening of houses as much as possible so that there is no contact between the mosquito and the person. Once that is prevented, then malaria is. Our call is that support from all stakeholders, philanthropists, good-spirited individuals to give the support to experts to educate, because education.
Other members also lent their voices on the issues bordering on health challenges and sensitization to ensure more coverage.
The malaria issue is not something you can leave for government alone. HIV is somehow on its knees now because somebody somewhere was ready to pay the bills, not government. COVID was tackled from every angle, not because of government efforts, but because of individuals who have the will to come into it. So this is an opportunity to call on well-meaning individuals, private companies to partner with governments, because this burden, if you leave it for government alone, it will overwhelm them, and we will not make any headway.
Well, malaria is a disease that has to be tackled both at the federal level, at the state level, by individuals, by pharmaceutical organizations, and by the citizens, because we all have a role to play in ensuring we eliminate malaria.
The Ministry of Health has come up with. The council has provided platforms to train the stakeholders in the pharmaceutical sector, and so in line with health education, health promotion, these stakeholders in the community are taking the information to the grassroots in support of the fight against malaria.
On this World Malaria Day, the call to action is clear: invest, innovate and implement to deliver zero malaria. It is a rallying cry for governments, organizations, and individuals to increase their efforts towards eradicating malaria and saving millions of lives.